What causes UTIs in relation to bladder anatomy? Have you ever wondered why urinary tract infections, or UTIs, seem to affect some people more than others? The answer lies in the fascinating anatomy of the bladder and its surrounding structures. UTIs occur when bacteria enter and multiply in the urinary tract, often targeting the bladder. Let's break down how bladder anatomy plays a role in this. First, consider the urethra, the tube that carries urine out of the body. In females, the urethra is much shorter, about 4 centimeters, compared to about 20 centimeters in males. This shorter length means bacteria can reach the bladder more easily in women. Additionally, the female urethral opening is located close to the anus and vagina, which are areas that harbor bacteria like Escherichia coli, the most common cause of UTIs. This proximity can lead to bacterial contamination and migration into the bladder. Next, let's look at the bladder itself. It is lined with a specialized layer called the uroepithelium, which usually acts as a protective barrier against infections. However, certain bacteria, especially uropathogenic E. coli, have developed structures called pili or fimbriae that allow them to cling tightly to the bladder lining. This adherence is a crucial first step for bacteria to establish an infection. Once attached, they can invade bladder cells, produce toxins, and form biofilms, making it harder for the immune system to eliminate them. The bladder's ability to empty completely is also vital in preventing UTIs. When urine flows freely, it helps flush out any bacteria before they can settle and multiply. If there are any issues that prevent complete bladder emptying, such as nerve damage or structural abnormalities, bacteria can accumulate and increase the risk of infection. Structural abnormalities, like bladder diverticula or tumors, can also create an environment where bacteria thrive. In men, an enlarged prostate can obstruct urine flow, leading to similar issues. Another concern is vesicoureteral reflux, where urine flows backward from the bladder to the kidneys, allowing bacteria to travel upwards and increase infection risk. Moreover, the presence of catheters or other foreign bodies in the bladder can disrupt its normal lining and provide surfaces for bacteria to colonize, significantly raising the chances of developing a UTI. Hormonal changes, such as those during pregnancy or menopause, can also affect bladder health. These changes may reduce the natural defenses of the bladder and urethra, making it easier for bacteria to invade. Additionally, any condition that weakens the immune response within the bladder tissue can increase susceptibility to infections. In summary, UTIs are closely linked to bladder anatomy. Factors like the shorter female urethra, the adherence of bacteria to the bladder lining, and any anatomical or functional issues that impair urine flow all contribute to the risk of developing a UTI. Understanding these connections is essential for maintaining bladder health and preventing infections. If you have concerns about UTIs or bladder health, consulting a healthcare professional is always a wise choice.